I'm Dr. Durga Prasad, consultant pediatrician at Ankura Hospitals, Banjara Hills. Today we're going to talk about basic fever. Fever can be anything from an ordinary viral fever, it can be because of sunstroke in summers, can be anything. It's common fever. Viral fevers are very common in kids, and these fever episodes are very common, like it's like around 4 to 5 times a year till 5 years of age. Initial 1 year of child, see, in a common pediatric practice, what we see is first 1 year of age, we don't see much of a fevers in kids because the child is home, breastfed, the immunity which comes from the mother is there, which protects the baby. After the first year, second year is also not that much, but the moment the child starts going to school, these children get frequent episodes of fevers, cold coughs, or whatever infections. This is because they are suddenly getting exposed to outside environment, and the other kids who has a fever, they catch up fevers very fast because the immunity from the mother, which they gain from the mother, starts disappearing, and these infections make the child gain their own immunity. So initial first couple of days of fever, only fever, child doesn't have any other symptoms. We are going to manage the child only with symptomatic treatment by giving paracetamol and sponging and keeping the child hydrated by giving him a lot of fluids. Even after that, the child continues to have fever and develops other symptoms like cold, cough, loose motions, vomitings, rashes over the body, or frequent urination, that is passing urine very frequently, or crying while passing urine. These are the symptoms where you need to take a medical attention. First couple of days, just treat the child with paracetamol and sponging. Sponging will reduce the temperature very fast and hydrating the child. So fever is to be monitored regularly to the child, and if they are very high temperatures on the initial day, first 5 years till 5 years, we have to be very careful because most of the kids would be prone for febrile seizures. Febrile seizures are the temperature spikes up very fast. Sudden rise of temperature, the child may throw a fit. That is not a very serious issue also, but keeping the temperature under control till you seek the medical attention is the basic thing what we have to do. If the child develops any other symptoms after the second day and the fever is not reducing at all, it's the time where you need to see a doctor. And the major question what I regularly get with the patients is, my first kid, you never used to get any infections or any fevers for first 2 years, but my second kid is getting lots of infections. The second kid will get infections because the first kid goes to the school, carries the infection and transmits it to the second one. So the second one would have more amount of infections at first 2 to 3 years, but he will be more immune by the time he joins the school. This is very commonly seen in the parents who ask me the questions and who have 2 kids. So these are all common things. Fever first day, don't get panicked. Just symptomatic treatment is a major thing what we do. Thank you.